So you have a perforated gastric ulcer and you need to do a Graham patch repair. What does that mean? Well, here's a big hole in our stomach. Okay, this is a perforated gastric ulcer. It's perforated on the anterior part of the stomach. The posterior part of the stomach is a little bit more challenging because we have to enter what we call down here the lesser sac. Okay, but we're going to keep it simple for this one. So you have an anterior gastric perforation. So what is described as a Graham patch is we actually take a tongue, we call it, of omentum, which is fat hanging here down off of the transverse colon, which is coming over here. So this is your transverse colon, and it has the greater omentum, which is literally like a sheet hanging from it. So we take a tongue of that fat and we bring it up here. Now, a quote modified Graham patch would be if we close the actual ulcer, and then just a traditional or formal Graham patch would be when we take this tongue of omentum and we suture it down to actually patch the hole. And it's interesting because whenever you go into the abdomen, when there's some type of bad inflammatory process happening, like a hole in your stomach, God or whatever you believe in, our body is already doing this most of the time. So the omentum we call is the policeman of the abdomen. And during a bad appendicitis or a perforation in the sigmoid colon from diverticulitis or the stomach, that omentum is going there and trying to literally plug the hole. And that's what we actually do as surgeons, is we use it to our advantage to do exactly what it's basically designed for. And that's what's called a Graham patch repair. Really good operation in the setting of a perforated gastric ulcer.